So welcome back everybody. It is Wednesday afternoon and this is my second interview only, and I've got Dr. Manrina Rhode with me. So hi Manrina, how are you?
Oh, I'm good, Nikki. How are you?
I'm good, thank you. Looking all fresh and lovely. What have you been up to?
I went for my lunchtime gym session, so I'm fresh from the gym.
Oh,
Good for you.
Good for you. Good for you. Great, great. So Manrina, people see you on social media, they see what you do, but I mean today's all about finding out who you are. So can you just do a little intro, who you are and what you do to everybody, those of you that don't know you?
Yeah, of course. So I'm an aesthetic dental surgeon. I graduated from Guy's in 2002. So yeah, I've been doing this for 19 years. Yeah, my practice is predominantly in aesthetics. Yeah, that's me. That's who I am.
Okay. So
I'm not sure if we could define ourselves by our jobs though, Nikki. I was reading an article yesterday.
Not, and that's what today is all about, actually drilling down into who you are and what does drive you and define you. So how did you feel about being awarded this accolade this year and being a 50?
Oh, I squealed with delight. It was such an honor and I was so pleased. It's my second year in dentistry.
Oh, well done.
But what I loved about this year was that it wasn't the popularity contest that it was last year. You know, they took a board of people to decide, and out of that to be chosen by those people to still be one of the most influential people in dentistry was such an honor. So pleased, I'm so proud.
So in here, what's it mean to you?
I guess it's a recognition of all that I try to do for our profession. I started this talk with you by describing, when you said, you know, describe yourself. I describe myself by my profession, and I think that's so interesting. And it's such a big part of my life. It's something that is the majority of my life is my title that I'm an aesthetic dental surgeon, and I put so much into that, not only into my clinical life but outside of clinic. In building awareness, in teaching people, in helping my patients and helping other dentists to succeed. And so, yeah, to be recognized for the effort that I put in means a lot. Yeah, it felt great.
That's lovely. So what are your main driving forces, would you say?
Oh, I've always been massively driven as a person. So even as a child, anything that I've done, I've always wanted to do my best and kind of be the best at it or not do it. I've got this. If you look back at my history, I love to work out, and I guess that shows right now. I've just done my lunchtime workout, and I guess people who follow me on social media probably know that about me. And what I've always done is if you look at my history of my 25 years of working out, is I take something like, say capoeira, or I take boxing, or I take different skills that I can learn, and I go at them for like 6 months until I really feel like I've mastered them. And then when I feel like I've mastered them, I was like, yeah, I get that. Then I move on to the next thing, because it's always been so important to me that anything I do. So with all these sort of workout things, I think it's a nice thing comparison to talk about. You go into them and you're such a beginner, like you go into a boxing class and it's a room full of men, and you think, okay, I'm a woman here, but I want to be a good boxer, and I'm going to push it, and I'm going to do it, and then I go through and I push through until I feel like yeah I've got this. So yeah, I've always been very driven in every aspect of my life, that anything I do to the best of learn everything about and do to my best of my ability. So it's definitely a personality trait.
Yeah, oh no, that's fantastic. So clearly, you know, to get where you are, you'll have faced many challenges. So what would you say have been your main challenges, and how can you influence other people to overcome similar barriers, or to not have to deal with similar things that you've had to?
Yeah, so I think the challenge whenever you pick up a new skill. So I came at this very young. I graduated in 2002. I did my vocational training year, and then I was really fortunate in 2003 to be taken on by Lund Oslo, which was a cosmetic dental spa, and really was very, very before its time. You know, it was probably the only cosmetic dental spa in the UK at the time, or the only practice that was doing the sort of things that they were doing. So I was thrown from VT into high-end luxury cosmetic practice.
Wow.
Yeah, and people always like say to me like, oh, that must have been so scary, and it probably was back then, but maybe I didn't feel it as much because I felt so supported by my mentors and by my peers, you know, I was in a very supportive environment where I could ask questions and I didn't ever want to make things up. You see dentists sometimes now trying out a procedure, like, oh, I saw a post on a dental Facebook group the other day, and this poor dentist came on and she said, oh, you know, I tried to do my first veneer case and it was so stressful because I was prepping the teeth, and then I put my temporaries on, and when I was prepping I didn't know if I prepped too much or too little, and then I put my temporaries on and then I didn't know how to keep them on there. I put them on with temp bond and then they just kept falling off, and the patient kept coming in and then they could see the preps that I'd done, and then finally I got to a stage where the veneers were ready and I was like, great, I'm going to cement them. And then I tried to cement them, and then as I tried to cement them, they didn't fit next to each other, they kept popping off, and then I tried cementing them one by one, and then they didn't fit next to each other, and it's been so stressful, and now the patient keeps coming back because the veneers keep falling off. And so I'm reading this post like this with my hands over my eyes like that emoji thinking, oh, you know, that we don't need to do that in dentistry. We're so, I think we put too much pressure on ourselves to be able to do everything. And we can't do everything. You know, I don't pretend to do everything. I don't even nearly pretend to be good at everything. I'm really good at veneers. You know, I've done over 12,000 of them, and I know that my skill set lies there. But don't ask me to do a root canal treatment. Don't ask me to extract a tooth. Don't ask me to clean someone's teeth. And you know, I haven't done that in 18 years, and I wouldn't be the right person to do that sort of treatment for you. So I think don't just watch a YouTube video and then think you've learned how to do a procedure. Do the treatments that you're really comfortable with doing, and go on courses and get the education that you need, so you do feel confident. And then often through these courses, there's some form of mentoring. Mm-hmm. So, you know, I run a course, I teach dentists how to do porcelain veneers and how to do smile makeovers with porcelain veneers. And they know that after they've done my course, they can contact me anytime and they can say, oh, this has happened, or what should I do about this? And because I know that they're working in the way that I've taught them, using the procedures that I've taught, it's very easy for me to advise them and guide them. And I'm so happy to be a mentor to all of them. And even people who haven't done my course, who often message me on social media asking questions, you know, where I can help, I will. So I think dentistry gets stressful when you feel isolated, and I think it's a matter of finding your mentors, and getting the correct education, and not pressurizing yourself to do everything, but to slowly build up, and as you feel confident, bring a skill in, but make sure you've got some mentorship in place to support you as you introduce that new skill to your practice.
Perfect. We've clearly kept laser focused through the whole of the COVID adversity. So yes. What advice would you give to our viewers today about keeping your eyes on the prize, your sights on the horizon, to come through at the other end and be successful, you know, achieve your goals and your aspirations?
Yeah, so I've had a message from a whole bunch of dentists actually during this time, who are really losing focus and, you know, feel really frustrated, associates feeling frustrated with their principals feeling frustrated with the amount of money they've lost through this whole process, and whether they're even going to be able to keep their practices on. And I think it's really important to have that vision about why we're doing this and what we're trying to achieve. And I think that vision needs to be really personal to you. So it can't be, I want to help people. Unless you really, really just want to help people and that's what you want to do, then yeah, keep that as your focus and say, whatever happens, I'm going to help people and this is how I'm going to do it. And then you keep that vision. Or you have a vision for something that you're trying to create for your brand or for your life, or for, you know, your vision is, I want to create this amazing practice. And, you know, had a really interesting Clubhouse room yesterday. I have this aesthetic dentistry club on Clubhouse, and last night's topic was boys and their toys, and ladies and their toys, and it was about tech in dentistry. And I think what was so interesting and what we all agreed on as dentists was, we don't buy this really expensive tech because necessarily it's going to necessarily make our lives easier, or for any other reason other than we just want it. And it gives us stimulation and it makes us excited to go into work because we've got this fun new toy to play with and offer our patients. and probably our patients wouldn't know, you know, either way. They don't, you know, they're used to having an impression taken. If you buy a scanner, great, that's really exciting for them, but it's unusual for a patient to come in asking for a scanner to, you know, to be part of their workflow. And so, yeah, maybe it's just realizing what it is that excites you about what you do, and holding on to that. And sort of maybe further on, going on further from that, the advice that I often give to young dentists when they come in and they feel a bit disillusioned with it all. And I think sometimes people can feel disillusioned when they come in to NHS practice. And I advocate when you graduate going into NHS practice so that you can hone your skills and see those 50 patients a day and, you know, really get experience underneath your belt. But I say that while you're going through those transformative years, or those initial years where you're learning, look at all the different aspects of dentistry and find out which one relates best to your personality. So, and we're so fortunate in dentistry that there's so many different fields that you can go into. You know, if you feel like you'd like to be a general dentist and you'd like to do lots of different things, and that's what would make your day interesting for you, then absolutely do that. But if not, and you find that frustrating, then, you know, who are you? Do you like to garden and clean things, and maybe you want to go into perio? Or do you like to work with a microscope and do really intricate little work, and then maybe you want to go into endo? Or do you like all surgery and the blood and gore of it all? And, you know, whoever you are, then you know, look at your own essence, and then bring that into your daily practice, because obviously the goal is that it shouldn't feel like you're going to work. It shouldn't feel like work, right? It should feel enjoyable, and you should love every day. And then when hard times come like this, it's not like, you know, I came away from this, you know, when we were all closed down last year and thought, oh yeah, I don't ever want to prep another veneer again. You know, I couldn't wait to get back and get in there and be doing smile makeovers and helping my patients, because it's something that I genuinely enjoy. I really enjoy that process of someone coming to me with a cosmetic issue, trusting me to help them look better, and me going through that very exciting process with them and taking them to their end result, where suddenly they're much more confident. You know, they may get a new job, they may get a new partner, they, you know, whatever it is that they want to change about their interactions in their life. I personally find that very gratifying, and so something that I enjoy, regardless of whether you're paid for it or not.
Yeah, brilliant. So what's your next goal professionally, would you say?
So many, Nikki. Yes. So I created my brand, DRMR. So that's Dr. Manrina Rhode. I created my brand last year in lockdown. I already had it on the horizon, but I had all that time in the first lockdown to really focus on that and hone it and get it ready to launch. And then within my brand, there's 3 categories. So I have my clinic, I have my skincare line, and I have my courses. Mm-hmm. And all 3 are due for big expansions. So there's so much going on all the time behind my clinical practice. My clinical practice I do because I enjoy. So I go in and I work in surgery 3 days a week. But the other days of the week, certainly the other 2 days, and even at the weekend, I'll be working on projects associated with all those 3, with skincare, with marketing and developing new products, with my course. You know, my course is sold out for this year.
Oh, amazing! Already.
Yeah, there's one spot left in October, and I'm sure that will go soon. And then 2021 is sold out, which is amazing. And I'm in the process of creating an online course, so a very similar course, but with modules that you can buy online. Traditionally, people were flying in to do my course from around the world. Obviously, that's not something that's very easy for them to do at the moment. And lockdown made me realize that it was time to really get this online course out that had been on my mind for a while. But again, I don't want to do it without it being absolutely, you know, how I want it, what my vision is for it. So it's been a process. Yeah, finding the right videographer, finding the right spot, and the rest of it. So yeah, so for all 3, there's big changes on the horizon. Last year was a really massive year of growth for me, and this year is continuing. By the end of the year, there should be more really big things to announce.
Wow, fantastic. So Manrina, as an individual, as a human being, what are your values, would you say, and what is the thing that you value most in life?
Oh wow. In life, wow. Maybe loyalty and honesty are really massively important to me. I'm fiercely loyal and probably fiercely honest as well, which people either love or hate about me, because if you ask me a question, I'm going to give you a very direct answer. And I really like that in other people as well. I don't like people to wishy-wash around me. If you want to say something, just say it how it is. Don't compliment me for the sake of being charming. Compliment me if you mean it, and I will appreciate it. Honesty and loyalty are massively big things for me.
Brilliant. So looking from where we are at the moment, jump 10 years forward, where do you see yourself, Manrina?
Oh, this is exciting, Nicki.
You could put yourself in a time machine.
Yeah.
Just fly 10 years ahead. Where would you like to land?
Yeah, so my plan is, and I don't tell many people this, and I feel a bit funny about saying it on out in public, because you kind of feel like if you say it, you've got to do it. But this is the plan, and this is what I'm working towards, is I want to create a super clinic on the coast. So I've got this vision of exactly what it looks like. It would be coastside. I always thought it would be in a warmer country. I'm not sure how Brexit's going to influence that, and whether it would be in the UK, but even in the UK, we've got such beautiful coastline. I've lived in central London since I graduated. I came to central London for university at 18, and then obviously straight after VT, I was the first dentist at Harrods and Harvey Nichols. So I've been in Knightsbridge since then. I bought my place here, and I've lived here, and it's great. And Knightsbridge is great, and I love where I live. But it would be nice to leave London, and it would be nice to live on the coast and just create this really beautiful clinic with a beautiful ambience that people can travel into, have their treatments, they almost be like a little break for them.
Oh, that sounds idyllic. I live on the coast.
Oh, lucky you.
I totally get that. I'm on the Yorkshire coast.
Oh, wonderful. Oh, that sounds, you're in the perfect spot.
Yeah, we've got the Wolds, we've got the coastline. It's beautiful. So I totally get where you're coming from.
Yeah, thank you.
So all the very best for that vision. You're absolutely right. I think if you vocalize it, you are way more likely to do it. I think.
Yeah. It's always in my mind that's where I need to end up. So it's like, how do I get there? Yeah.
So thank you so much for joining me today. I know you're a very busy lady, and I'm so grateful for you. Just opening up and letting us know a little bit more about yourself.
Oh, it was my pleasure. I will go and dry my hair now.
I'll let you go. Don't get a chill. All right. Thank you so much, Manrina. Take care, and the best of luck with everything.
Thanks, Nicki. To you too.
Okay, thank you.
Thanks.
Bye.
Bye.